Hello everybody, this is Gary. Today is March 16th, 2022. It's Wednesday. It's 5:52 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm doing pretty good. I went out to Walgreens to pick up some prescriptions. I came back, went food shopping. I did my physical therapy exercises a little while ago. Before that, I spent an hour on the exercise bike. Um, Obviously I'm making this video. That's part of my daily schedule is to make these videos. I did some morning meditation when I first got up this morning. I did some work on my computer. Just trying to keep up with my daily schedule and keep busy, keep myself occupied. Having structure and keeping occupied with work and other things helps keep me stable with my paranoia, my delusions, my auditory hallucinations, my depression and my anxiety, and my insomnia. I notice that I'm sleeping better. I think it may be because I'm exercising more. I do have some weight that I have to lose. I've been exercising more for the past few months, and I am continuing to do so. And when the weather gets a little nicer here in Rochester, New York, as spring comes, I'll be taking my bike outside and riding it instead of using the stationary bike inside. I never ride my bike during the winter. It's too cold, and I can't ride against the wind. I'm getting too old for that shit. But I'm not too old to ride my bike during the spring, summer, and early fall, which I will be doing as part of my daily schedule. Yesterday I had group therapy. It went pretty well. I stayed engaged. I had brought up different topics. We had different discussions, which I can't talk about because of confidentiality, but the group went well. And it was the last week of the first 10 weeks of group therapy. There's a second block of group therapy coming up at the end of March, and that will be for 8 weeks. It's for DBT therapy, dialectic behavior therapy. It's a form of psychotherapy that teaches mental health clients how to withstand stressful situations, both internally and externally. Intense emotions, intense psychiatric symptoms, and intense environmental stressors. That's the basic definition of dialectic behavior therapy. I saw my psychiatrist last week and I saw my therapist last week. We didn't change much of anything. We didn't change my medication or anything. I'm continuing on with 0.5 milligrams of Klonopin twice daily, 0.5 milligrams of Zyprexa twice daily, 600 milligrams of Seroquel nightly, and all the other medications that I'm taking. I'm on like 10 or 11 different medications for physical ailments as well as psychiatric illness. So I'm pretty much keeping up on my medication regimen, taking all my meds when I'm supposed to. As far as my psychiatric symptoms are concerned, my delusions are not too bad today. My anxiety levels are not too high. My paranoia is not that bad. My auditory hallucinations are pretty low key today. They're always with me. They're always telling me that people are following me, spying on me, but I'm able to ignore them. When you hear voices for as long as I have, for years on end, you learn to ignore them when they're less intense, even when they're there all the time. You would think that hearing voices would keep me from falling asleep, but even people who hear voices get tired and eventually fall asleep. At least I do anyways. I have a MRI scan coming up for my right knee because I have intense pain in my right knee that keeps fluctuating up and down. Right now, today, it wasn't so bad. I was actually able to walk pretty well on it today when I went shopping and when I went to Walgreens and when I used the exercise bike. But every once in a while, it keeps flaring up, swelling, turning red. So we're going to do an MRI scan, see if there's any damage to the cartilage in my knee or the tendons or the soft tissues. I do take a leave for the pain, which is also known as naproxen sodium. Sometimes I'll take Tylenol. Tylenol is good for the pain, but it doesn't do much for the inflammation and swelling. So we'll see if there's any damage to my right knee. As far as the physical pain that I've been having in my muscular skeletal system and my nerves, my actual physical nerves, and my joints, I've been taking for about 5 weeks now Cymbalta, which has helped control most of the physical pain that I've been having throughout my body. I still have arthritis in my left hip, arthritis in my knees, arthritis in my upper and lower spine. I saw the orthopedist a couple of weeks ago. He said one of the discs in the lower part of my back is almost completely worn away, but that's normal with aging. I'm continuing with physical therapy to strengthen the muscles around that disc. We're trying to avoid any need for back surgery, and I'm also hoping that I don't need any surgery on my right knee. I've already been through 2 surgeries in the past 12 months, and I really don't want to go through back surgery, and I really don't want to go through knee surgery either. Both of those can really restrict my movement. I'm hoping that there's no damage to my back that needs surgery and no damage to my knee that needs surgery. I really hate having to go to the hospital. I hate staying in the hospital for a couple of days after surgery and then coming home and not being able to move about physically. It really screws up my exercise routine in trying to lose weight, partly by exercising. So I'd rather not have surgery. Having medical problems complicates mental health issues a great deal, but most of my physical pain has been reduced by the Cymbalta. But I'm also taking Flexeril for the muscle pain, and as I mentioned, arthritis pain. I'm taking Aleve Tylenol, and I'm also taking Neurontin for the nerve and muscular skeletal pain, as well as the joint pain. So that's all the report for now.